Not only do they save lives, but for many women, it's their first line of defense when battling breast cancer. Here to tell us about the importance of getting regular mammograms is Dr. Denise Reddy from Scottsdale Medical Imaging and Sandra Powers, a patient who experienced this difficult time firsthand. Good morning, ladies. Thank you so much for joining us. Doctor, I'm going to ask you in just a couple of minutes about the importance of mammograms and a new study that's been out in Canada. But Sandra, let me ask you first, tell me how you were diagnosed and how you learned you had breast cancer.
On October 30th of last year, 2013, I went into Scottsdale Medical Imaging Laboratories for a routine mammogram, and I was sat down by Dr. Reddy, and at the end I was told that there was serious concerns. And then they put me together with Pam, who is a patient breast navigator and an RN, and she started scheduling me very important tests, a lymph node biopsy, a core biopsy, and based on how rapidly she was on those phones booking those tests, I knew that we had a problem.
And it seems, I mean, your experience, I mean, tell me what happened next after that.
After that, on November 8th, I was called in and met with Pam, and that's when my official diagnosis came that I did have breast cancer.
And tell me about this picture right here, who we're seeing there.
That's Pam. I call her the angel, Pam Turgeron. She is an RN and works with breast cancer patients with Scottsdale Medical Imaging Laboratories.
And it seems that from the very beginning, I mean, you were saying you felt like they really cared for you and they kind of held your hand and tell me, like, they put together your team that's so important when it comes to this.
At that moment, everything in my life changed, and they became the experts of what I was going through, and their company was branded in my mind for a lifetime because nothing that I had was going to be the same when I walked out the door. And I had so much to process that I realized the best bet was to go to the experts, which is Scottsdale Medical Imaging Laboratory. And they did give me a referral, and my whole medical team was put together as a result of their referrals. And I have been very blessed with an outstanding medical team as a result of Scottsdale Medical Imaging Laboratories.
Tell me about some of the highs and lows of this journey that you've been on.
I would say the highs. My daughter is 22, and mothers and daughters take a while to get along, and we have the most amazing relationship I could ever ask for now.
Is that your daughter right there?
That is my daughter.
Beautiful.
The low would be she had just gotten hired as a pediatrics RN nurse, and she was 2 days into training, and we would find out that through the first 2 months of chemo, she would be a threat to me and not allowed to be around me because of the viruses she would be exposed to as a pediatrics emergency room nurse for children.
All right, and I can't imagine you can't be around your own daughter. I mean, and tell me in your whole experience so far with Scottsdale Medical Imaging, tell me about the difference between, to kind of let people know the difference between being cared for and being cared about.
There's a huge difference. Whether it was I was sitting in a room crying and someone came up and brought me a tissue or put their arm around me, or a tech would tell me, you can do this. There is a difference. They care. You are not a number. You are a person. You are an individual. And that's hard to find this day and age.
And that's your team right there?
That's my team of friends right before going into surgery on November 25th.
And, a mammogram is what brought you and let you know. And you said you were only, 8 months late on your mammogram. I mean, it was something that you consistently did and stayed on top of. Dr. Reddy, let me ask you, there's that recent study that just came out of Canada. Briefly tell me about it and how important is getting mammograms for women?
So there's been a debate that you've seen some in the media with different studies saying that maybe we should reconsider when we do screening mammograms. And the Canadian study adds to that debate. Like the other studies, it's not perfect. There were some questions raised about how they randomized the patients in the trial. We need to keep an open mind about the debate, but that being said, right now, mammography is the best tool we have for early detection of breast cancer. And the current recommendation is to get a mammogram every year beginning at the age of 40. In the future, the way we screen women may be a little bit different. It may be more personalized based on a woman's risk. And at SMIL now,
family history.
Right, exactly. And at SMIL, we're trying to help women. We have some tools available for women to help them better understand their family history and what their own personal risk of breast cancer is and how that plays into when and how they should be screened.
All right, doctor, thank you so much. Sandra, thank you for coming to share your story. one quick piece of advice you give to any woman out there listening to this, what would you want to say to them?
Get your mammogram. It saved my life.
All right. Thank you so much for coming in. We appreciate it. And if you'd like more information about Scottsdale Medical Imaging, just visit getamammo.com or call the number you see right there on your screen.